My name is Stephanie Magis, and I'm the Senior Manager of Employee Health and Safety Programs with the City of Winnipeg. Health and wellness is an important part of our programming area. We offer a number of services to our employees to support them through mental health issues and wellness topics. This includes employee family assistance programming. This includes things like employee supports for individuals who are struggling with mental health issues, and lots of services that encompass all of our employees. Our occupational health team was an important part of our strategic planning through the emergency preparedness for COVID-19 pandemic. We were really focused on a number of initiatives that allowed us to educate our employees about the COVID-19 pandemic, about how to best mitigate some of the circumstances surrounding that, and really reduce transmission of COVID-19. So our education, strategic planning, and support from our leadership was instrumental in helping us along with all of our wellness supports throughout the pandemic.
My name's Angie Cuson. I'm the Director of HR Services, and I work for the City of Winnipeg. As Director of HR Services, my role is to provide oversight to the 8 HR generalist teams that are embedded in the large city departments, as well as the 7 corporate HR teams that provide programming support and for consistency with the 8 departments for the 10,000 staff that we have. As an organization with 8 large departments that function as their own individual business, essentially in their own industry, we rely on our health and safety teams to get to know their work, understand the needs of that particular department, and then provide safety services that match. Mental health has been one of the key priorities that we've identified as something that we need to be able to provide more attention to. We have some important, we'll say, employee wellness programs that exist, particularly in some of our core areas where staff have significant challenges. We're talking in the Winnipeg Police Service, the Winnipeg Fire Paramedic Service, as well as we have a position within our we have an occupational health unit that provides support in that area, and then we also have some additional mental health programming that are going to support some of those key individuals that need the extra support on the mental health side. We also have a wellness coordinator that also provides generalized, we'll say, mental health programming, wellness support, and then we also have a lot of employee education, as well as our EFAP program that can support all 10,400 staff.
My name is Sandra Conrad, and I am the Professional Services Manager for Dealer Pilot HR Automation. So we've really made wellness a priority within Dealer Pilot for our in-house programs. We decided to champion an initiative on wellness within the organization with a focus on mental health and physical well-being, personal well-being, and instead of work-life balance, we've decided to focus on work-want balance. So we have different capacities as people about what we want in terms of balance, whether it's recreation or more work, and some people take pleasure from doing things that are work-related. So we've decided to give the opportunity to our staff to really focus on wellness. So we've done that through mental health initiatives, work wellness initiatives, physical well-being, and a number of other components. So we've provided staff with the opportunity to gain social circles and have a work wellness balance instead of a work-life balance. This means that they can actually gain that benefit through their colleagues and through gaining extra opportunities to do what they love, whether that's career-oriented or not.
I'm Susan Black. I am the Director of Human Resources and also a partner at FH Black & Company. The initiative was really, it was born out of necessity, I would say. So I'm a fitness teacher as a volunteer at a gym in town, as is one of the other partners in the business. And when we all went home in March and gyms closed and our office closed, all of that stopped. So for me personally, that was a huge immediate loss of a whole community and a need to not only give, but like connect with people. So I thought I'm gonna just turn the camera on, people can work out with me. And it evolved from just doing a workout to an actual program that we implemented at our company. It was such an amazing day when we had everybody come on screen. It was just a really cool way to connect with our staff and help their mental health and their physical health, because it's all combined, right? I think it's all one and the same. Really good for our corporate culture and good for the employees. So you can't beat that, really.
My name is Adam Smolik, and I'm the Managing Director of Film Training Manitoba. Prior to the pandemic, there was a film production in Manitoba where over 40 crew members caught a flu virus. So when COVID-19 struck in Manitoba, our organization coordinated and calibrated industry-specific training for COVID-19 while in production. People that work in film work at such close proximity that our organization really needed to develop and carry out this training so that there was a level of safety for our industry. Unfortunately, when you look at other regions within the country, they simply just did not have this form of training and learning outputs. And you can actually see that in many cases, productions actually completely stopped because the virus was spreading, unfortunately, on production. I think it's really commendable that the working professionals in our industry adapted and followed self-regulation and put in place safety protocols so that this virus could be mitigated as best as possible. And I'm really proud of all the work that the technicians, the administrative workers, our partners, all the various organizations that we worked with were able to carry out.